Hi everyone. This week, Kate Middleton announced that she was done with chemotherapy. A lot of discussions in the media about this, but I thought this would be a good opportunity to talk about what it really means when someone is done with active treatment. Active treatment for cancer can be chemotherapy, surgery, radiation, varies for different people depending on the type and stage of their cancer. But often when someone is finished with, let's say, chemotherapy, right, they're told, oh, congratulations, you're done. And absolutely, we should celebrate that milestone because that is a huge milestone. But it doesn't mean that cancer is now all of a sudden behind that person. And there are a number of reasons for that. Number one, typically after that active treatment, many patients are put on maintenance therapy, and that can mean immunotherapy, endocrine therapy, anti-HER2 therapy, PARP inhibitors, you name it. That list is broad, and all of those maintenance therapies come with a whole new set of side effects that someone has to navigate. So not only are they recovering from everything they've gone through, now they've got all these new side effects. That leads me into recovering from everything that someone has been through. And a lot of our treatments have lingering effects. This can mean fatigue. This can mean neuropathy. This can mean limitations in range of motion, pain, skin changes. And again, that list is pretty broad. So just because someone received that last chemotherapy treatment doesn't mean that all of those symptoms that they've had are all of a sudden going to immediately go away. It can take time. And that's when we really begin the healing process. When someone is diagnosed with treatment, it's typically go, go, go. Okay, you got to meet your doctors, you got to get your treatment, you got to get your surgery. And that often doesn't leave a lot of time for people to process kind of what's happened. And that's really an important part of healing. Many patients find that their mental health is affected, and it takes time to work through that. Often people experience a fear of recurrence, and that has both emotional and physical manifestations. There's a lot of grief that happens both during and after a cancer diagnosis and treatment, and reconciling with who someone was before cancer with where they are now, and all of that takes time. If you think about a simple procedure that you may have had in the past and the recovery just from that one thing, well, for patients who've gone through cancer treatment, it's so many procedures, starting with that first biopsy through everything they have to endure. And so what I share this is that if you are a caregiver, a caretaker, a friend to someone who's gone through this, a family member, to continue to check in on that person, because what I hear often is that patients get a lot of support during that active treatment time, but then when they're done with active treatment, that support tends to sometimes pull back, or people expect them to be back to their normal selves, and they're not, because of all of these reasons and that time in the recovery. So that's what I wanted to talk about. I would love to hear from you in the comments about your experiences. Let's have a conversation.